Everyone desires a flat abdomen, be it male or female. There are many options available in the market, surgical as well as non-surgical options. Whatever be the options chosen, the bottom line, everyone has to follow a regular diet and exercise program. Non-surgical options include cryolipolysis or cool sculpting techniques. It can involve an external ultrasound or an external laser. Whatever be the technique used, the load is limited. All non-surgical options have limited role. They benefit individuals who are few kilos over their normal weight. All others require a surgical procedure. It could be liposuction, a combined liposuction with abdominoplasty, or abdominoplasty alone. Each of these techniques have definite role in individuals with different problems. Liposuction is a surgical procedure by which the fat between the skin and the underlying muscle is removed. The result of liposuction depends on the quality of skin. Once the fat between the skin and the muscle is removed, the skin has to shrink and redrape over the muscle to give a good contour. In individuals with lax, excess skin, liposuction alone will not be of much benefit. Liposuction is performed by introducing small cannulas of the size of 4 and 5 mm under the skin to suck the fat between the skin and the muscle. Usually the procedure is performed as a daycare procedure and patient could return home the same day. Normal activity could be resumed after 1 week. However, when multiple areas are performed in the same sitting, pain, discomfort could be experienced for a period of 6 weeks. Following liposuction, bruising or skin discoloration with numbness over the liposucked area could be experienced for a period of 6 weeks. Contour irregularities occur rarely. When performed by experienced hands, liposuction is a good procedure for contouring the abdomen. However, liposuction is beneficial only to individuals who have a good quality skin and there is no weak muscles. Abdominoplasty or tummy tuck removes all excess skin between the hairline at the pubic region and the navel. The underlying muscle is plicated or tightened. The skin is pulled and re-stitched and the resulting scar is hidden under the undergarments. Thus, abdominoplasty is beneficial for someone who have excess skin and a loose muscle, for someone who has a protruding abdomen resulting from a combination of excess fat, loose skin and poor muscle tone. Lipoabdominoplasty is the surgical option. First, a liposuction is performed to remove all excess fat. Then, abdominoplasty is performed. First, a liposuction is performed when the skin flaps are thinned. Then the excess skin is removed and the muscle plicated. At the end of lipoabdominoplasty, the individual gets a flat skateboard abdomen. When liposuction alone is performed, it could be done as a day surgery and patients could resume their activity after a period of 1 week. However, abdominoplasty or lipoabdominoplasty requires hospital admission for 2 to 3 days. Repeated follow-up for a period of up to 2 weeks is required. Rest at home is required for a period of 2 weeks. Vigorous activities, exercise, and sporting activities could be resumed only after 6 weeks, following an abdominoplasty or a lipoabdominoplasty. After liposuction, pregnancy is allowed. However, following abdominoplasty or lipoabdominoplasty, pregnancy is not advised, since going through another pregnancy can spoil the result and the muscles can become loose again. Liposuction is usually performed for the lower abdomen, upper abdomen, lateral flanks and the posterior flanks. This region is commonly referred to as the love handles. In abdominoplasty or lipoabdominoplasty, the skin between the hairline and the navel is removed completely. The underlying muscle is tightened in the midline. The upper flap is then tightened, brought down and sutured to the lower flap. The resulting linear scar remains hidden within the undergarment. Following liposuction, multiple small scars remain permanent at the port site. They are usually of the size of 5 to 7 mm. Following abdominoplasty or lipo-abdominoplasty, a linear transverse scar remains permanently at the lower abdomen within the undergarment.